Good afternoon. I'm Dr. Bonnie Henry, the Provincial Health Officer for British Columbia, and this is our COVID-19 report for June 9th. I'm very grateful to be speaking to you from the traditional territories of the Lekwungen-speaking peoples of the Songhees and Esquimalt First Nations, and we're very happy that we can have these important updates on these traditional lands. So today we have 9 new people who have tested positive for COVID-19 and 1 additional epidemiologically linked case, bringing our total new cases to 10 in the province and our total to 2,669 people in BC with COVID-19. That includes 908 people in the Vancouver Coastal Health Region, 1,370 people in the Fraser Health Region, 130 people in the Vancouver Island Health Region, 195 people in Interior Health Region, and 66 people in the Northern Health Region. There are no new healthcare outbreaks. We continue to have 4 active outbreaks in our healthcare system in long-term care. And we've also gone a day with no new cases in our long-term care. So we continue to have 340 residents of long-term care who've been affected and 218 staff. We have no new community outbreaks, and we continue to monitor and support at the 6 remaining outbreaks that we are managing. So that leaves us with 183 active cases across the province, of whom 16 are hospitalized, 4 of whom are in critical care or ICU. And another day, a very positive note, we have had no new deaths in the last 24 hours. So that leaves us 2,319 people who are now fully recovered from COVID-19 in BC. I'm very grateful that in recent weeks our numbers of new cases here in British Columbia continue to trend down and to be low. We have had, as we are aware, a number of small community outbreaks, but we are at that point where we are able to find these quickly, and that speaks to the work that we are all doing to follow the safe distancing rules, but also to stay away from others and to get tested if we get sick. But I want everyone to understand that the COVID-19 pandemic around us is far from over. In British Columbia, we continue to have small numbers of cases, but across Canada and around the world, it is still a major problem, and is going to be in our communities around the world for some time now. The global case count continues to rise, and many regions are facing a resurgence in cases as they've taken measures to open up, including regions that are very close to us in the United States. And just yesterday was the highest single day for new cases globally since this pandemic started, with over 136,000 people being affected. And we know that there are new regions of the world that are being affected. And when this is in one country, we are all connected. We know from several months ago that it matters to us when something like this happens in China. It matters to us when something happens in Italy, in Spain. It matters to us when it happens in the United States and here in Canada. And now we're looking at the challenges that are being faced by countries such as India and Brazil. It recognizes no borders, and it recognizes none of our geopolitical barriers that we put in place. Very early this morning, I was on a call talking with my colleagues around the world with the WHO, looking at how we are managing these cases and how we are supporting each other, how we're doing public health activities, what are the things that worked, how can we become more efficient and more effective at case management, at contact tracing, and we're learning from each other, and we'll be having a series of these over the next 2 days. But here in Canada, we know that international flights are increasing, and U.S. border restrictions are going to be eased to allow for families who have been separated for these last few months to be able to reunite. These changes are not unexpected, and they are important in helping us get our social fabric back together. We also know that many businesses and schools here in BC and across the country have reopened. So our goal needs to be to learn to live safely with this virus, to protect ourselves as much as possible as we do that. To do this, we need to be watching closely what is happening globally, what is happening in our own continent, and what is happening here in the province. And we need to take our measures that we have learned, that we continue to need to protect our communities, our families, and our province. And our path forward is to minimize, manage, and modify as we need. And that means we all need to continue to take the actions that we have been doing to minimize our numbers of close contacts and reduce the numbers of cases that we see in our community. We need to manage those clusters and outbreaks with rapid contact tracing, with making sure that we in public health have the resources to stop outbreaks from expanding rapidly. And we need to modify the measures we're all following as we need to, given the situation that we're facing here in BC. What all of us can do today and every day is to continue to assess our own risks in our family, our risks in our small communities, particularly if we're going back to school, particularly if we have people who are more vulnerable to getting severe disease, particularly if we have loved ones who are in settings like care homes. We need to take precautions to protect ourselves and those around us, whether we're at work, at home, whether we're traveling, whether that is essential travel that we're doing as part of our work, or whether it is being with our family over the summer and going to communities or traveling within BC. We need to continue without exception to stay away from others, stay home if we are feeling unwell. And anywhere in BC, you can get tested if you have symptoms that are related to COVID-19. And no matter where you are, we need to continue to follow our rules for safe social interactions. So that's smaller numbers, bigger spaces, safe distances, washing our hands regularly, cleaning our environment, and the added layer of wearing a mask if we're in those situations where we might not be able to maintain our safe distances. We've said all along that we are experiencing our pandemic here in BC, and nation to nation, province to province, state to state, our circumstances are unique.